Welcome to BW Healthcare World. Today is Hand Hygiene Day. Today, let me begin with a story. In the 19th century, of all the healthy pregnant women who were going to the hospital to have a baby, almost 18% of them died, and no one knew why this was happening. Until a doctor called Ignaz Semmelweis was who was perplexed with the situation, started studying it closely, and he discovered that the doctors who were involved with deliveries were conducting autopsies in one part of the hospital before they went to the other part to deliver the babies. And they went without washing hands. He started asking these doctors to wash hands and practice hand hygiene, and the death rate drastically dropped to almost 1%. But his efforts were met with resistance as doctors were offended because they got pointed out as the cause for this mishappening. Many decades later, in the 20th century, hand hygiene was institutionalized as a part of the sanitization process before any surgery that is conducted. Today, especially after the recent pandemic, hand washing and hand hygiene has become a way of life for almost all of us. To discuss the importance of hand hygiene, today I have with me Dr. Vijay Agarwal, who's the president of the Consortium of Accredited Healthcare Organizations, also known as CAHO. And joining him is Dr. Lallu Joseph, who's the Associate General Superintendent and the Quality Head at the Christian Medical College, Vellore, a 4,000 plus bedded hospital today. Welcome, Dr. Agarwal and Dr. Joseph.
Thank you.
Uh, my first question to both of you is I have had the opportunity because of my role at Business World to speak to a lot of healthcare practitioners. But both of you seem to be very passionate about the quality of patient care. I want to ask both of you what ignites your passion. Dr. Lallu Joseph, being a lady, I would give this opportunity to you to speak first.
Thank you. Thank you for that question. I come from a very different background. I'm an engineer by profession and got into healthcare in 2007. So little did I know about healthcare when I entered this large hospital that I thought that EEG and ECG, when I looked at both the boards, I thought it was a spelling mistake somewhere because I knew only ECG and I didn't know EEG at all. So that's the level of awareness about healthcare that I had when I entered healthcare in 2007. But a lot of things this industry has taught me, one of which is the passion for what people do. The passion to treat patients well, to take care of them. And that passion is with every doctor, nurse, every individual in healthcare to actually do the right thing. But what I noticed is that they are all excellent people, excellent in their work. But when it comes to working together, getting everything as a team together towards that common goal, there was something lacking somewhere. Everybody is an excellence in their own area, silos of excellence. So that's the main gap that I identified, having come from other industry, particularly the IT, where everything was all about working together. So that was the major gap that I identified. And when I got more into understanding healthcare, I realized that that's the main thing to address, to create the culture of safety and quality in healthcare. Because it's not about individual excellence. It's not about individuals doing the right thing, but about everybody coming together and talking the same thing, doing the same thing towards a common goal. And I have several experiences where I realized unless all of them work together, it's going to be a big zero. So that's the thing that actually drove me into getting people together, making everybody talk about quality and safety together as professionals, doctors, nurses, technologists, administrators, all of them coming together and talking about quality and patient safety, that individual patient. So all that we've been doing so far has been with that passion to get people together and talk about the common goal. I think that's something which, as a non-healthcare worker, or rather today I can proudly say I'm also a healthcare worker, but I was able to talk from outside with the industry perspective. And that's probably why people accepted me. And today I'm also part of them, very much part of them. And I'm able to drive this journey of togetherness in healthcare, everybody joining hands. So I'm very passionate about what I'm doing, certainly. And it's doable, it's achievable. And all of us coming together is the norm.
No, I can completely resonate with you, Dr. Joseph. Being a non-journalist, getting into media, the outside perspective that we bring in to what we are delivering today is sometimes really valuable. Dr. Agarwal, what drives you?
Well, unlike Lallu, I was, of course, right into this profession, having graduated from the prestigious Maulana Azad Medical College, then did my post-graduation in pediatrics. So it has been now 55 years of my existence of being into the medical world. And I have seen it from almost all angles, right from being a resident doctor to a senior resident to being a consultant in pediatrics, to be establishing a small hospital, running it, to be able to, setting up a bigger hospital and then running it, etc. Over a period of time, having worked with a lot of government initiatives and a lot of public health programs. So I can say that I have seen healthcare from a very close thing over the last 55 years. And what I have seen is that over a period of time, the healthcare has become extremely high-tech and complex and dangerous in a way. And the reason for that is that at one time, it was only a relationship between the physician and the patient. So I used to call that was a game of badminton, which has now turned into a multi-stakeholder delivery. It's a whole teamwork, like what Lallu has been referring to, that today healthcare delivery is a teamwork. And what I realize with great amount of, I would say, concern and distress, that today you see increasing amount of litigations and violence against the medical professionals. And one of the analysis that I have is the reason is that the doctor, again, like what we said, that all these people are fantastic workers. They are extremely kind of committed to what they do. But I feel that the clinician, the doctor, has to learn to be the captain of this team. Unless he is able to become the captain of this multi-stakeholder delivery care, we are going to get into problems. And that's where I feel that at this stage of my life, I got this platform called CAHO, which is the Consortium of Accredited Healthcare Organization, which was started actually very innocuously just to help the accredited hospitals come together, share best practices, create benchmarks, and things of that kind. However, over a period of time, what we realized that people are taking accreditation as the end of their quality journey, while that should have been the beginning of their quality journey. And we realized that somewhere we are not looking at the good practices in each individual specialty and department, and rather I am focusing on how do I crack the exam of passing this accreditation and getting the stamp of accreditation. So that's where at the moment, I want that whatever time I'm spending, actually I'm not into any operational role today. So I do feel that whatever time I spend, let it be a meaningful impact. And for that, I feel that collaboration with many stakeholders in the entire ecosystem is necessary if we want to create an impact. Because one of the learnings I'm seeing is that as an accreditation body, Joint Commission is there for 75 years. And United States is spending huge amount of money in that country, but still it is a broken system. And talking to them recently, I realized that they are not focusing at the granular level. They are not looking at the problems in each department, rather than it's a overall enterprise level feeling good that yes, you are looking at this committee, that committee, and I'm sure that this is what is causing the problem. And I think at the root of it, like what Dr. Lallu Joseph said, that it is nurturing teamwork, nurturing the culture of safety. That is extremely important, and that's what drives by passion.
Dr. Agarwal, my next question is to you that in India, people of our age, we've grown up seeing hospitals where you have that tobacco stains on the walls, people spitting outside. Uh, that's what we have seen in most hospitals, largely in government hospitals, but even private hospitals used to have this. But today, when we go to these hospitals, they're spick and span, and they are the hand hygiene is also available at every part of the hospital, not just restricted to OT. How did this journey evolve, or is it just something that we are noticing post COVID?
Well, as like you said, and I am saying in the early part of the medicine, in fact, all over the world, the hospitals used to be crowded. They lacked proper sanitation. They lacked infection measures, and at that time, there were the well-known term became people suffering from hospital fever or nosocomial infections. So that was what was happening around that time. And then what happened that in the middle of the 20th century, we started having antibiotics. And the emergence of these antibiotics decreased these hospital-associated infections or nosocomial infections for some time. But then the inappropriate use of the antibiotics started having another problem of emerging resistant organisms. And now you're having a huge other problem, and that's where this problem, of course, has been recognized. The major problem is, of course, the infections related to being there in the hospitals. Now, I will say that over a period of time, lot of cleanliness and this concept, and because of this emerging strains, this issue was well recognized even before the pandemic. There was huge amount of these talks, but were happening more in the accreditation related hospitals. But I think what pandemic has done is totally taken it to another level. It has accelerated this whole talk so that today, even a common citizen is knowing the importance of hand washing, masking, social distancing, and whatnot. So I feel that in a way, of the pandemic, this has been one of the blessings in disguise.
Dr. Joseph, every year there is a theme for Hand Hygiene Day. I mean, we've seen that 2022, it was cleaning at the right time with the right product. 2021, we had achieving hand hygiene at the point of care. This year, the theme is, I'll quote, together we can accelerate action to prevent infections, antimicrobial resistance in healthcare, and build a culture of safety and quality in which hand hygiene improvement is given a priority. Can you explain what this means to healthcare workplaces beyond this English?
So, as a healthcare worker, everybody knows, all healthcare workers would certainly know that hand hygiene saves millions of lives. And when performed at the right moment, and also for the right healthcare delivery. So all of us are aware of it. But still, are we really doing it? It's all to do with that culture. So unless that culture comes in, this is something that I have to do. Has to be ingrained in every healthcare worker. And it takes a lot of time to do that. As Dr. Agarwal rightly said, I think the overall concept of this hand wash, hand hygiene, thanks to COVID, it has come in. People do realize that this is the need of the hour to prevent something from happening. And these infections in hospital acquired infections, it's a major threat to patients who are staying with us. So if we don't do it right, the healthcare associated infections could kill patients. So we all know that 1 in 3 patients who is admitted, the official figure is 1 in 10, but that keeps varying. And in India, we don't have any numbers at all to substantiate. So we can clearly say 1 in 5 at least on an average gets harmed during healthcare delivery. And the majority of the harm is actually healthcare associated infections, which could easily be prevented. Now, at the healthcare level, we keep training people. We engage with them. When they are at induction, during their work, every single day we keep talking about it. We have posters everywhere. But at a community level, it is now important that patients are aware, engaging with the patient. And now it's all about patient centricity and patient engagement. If you looked at the previous campaigns of WHO, it was all about patient engagement, even the World Patient Safety Day celebration. So unless the stakeholder is involved in the care, it's going to be difficult. You have to ask the right question. Before the healthcare worker comes and touches you or starts a procedure, if the patient himself or herself asks, doctor, nurse, have you performed hand hygiene? Have you washed your hands? It is more effective than us reminding ourselves. So that is why it is so important to engage with the patients. And the reason why we are talking about, engage is not just the healthcare workers, but the large community, for which this year WHO has put in very clearly a mandate to engage with the civil society, because they have the passion, they have the drive, they have the connect with the community, and they also have the bandwidth to take it to a large extent to the community at a local level, at a community level, at an international level and national level. So which is why I think this is extremely important to accelerate the action, not just limiting to healthcare, but to the larger community. And when community and patients start asking the right question, it becomes the norm, it becomes the culture. So I really appreciate WHO for throwing this theme to engage with everybody, the stakeholders and the civil society to take it to the mass. And by and large, I think we also at CAHO, the Consortium of Accredited Healthcare Organizations, feel that we are a civil society because we now have a foundation, which is the Patients for Patient Safety Foundation. So through that, we are trying to engage with the patients to create the culture of safety and for them asking the right questions. So I'm excited that engaging has become the norm to accelerate patient safety and to drive patient safety to the masses. Thank you.
I think thank you for so much for explaining. It is so important now that I understand that, this culture of safety related to hand hygiene as a basic underlying effort that each one can make has to go beyond the healthcare workers and has to become a part of our community. Thank you so much for explaining, Dr. Joseph. Dr. Agarwal, we think our hands are clean and we are happy when we wash our hands, we rinse it with water, and sometimes we do it multiple times a day. But is there a way to find out if our hands are actually clean? In this era of AI and technology, do we have some technology that is available to us that can help us understand if our hands are actually clean?
Harbinder, very interesting question that you have asked. Because unfortunately, if you talk scientifically, is there a way for me to instantly know that I am free from the bacteria or my hands are not contaminated to cause infection? The answer is no. Yes, based on, I will say, a lot of work and studies, certain protocols have been made that if you follow those protocols, let's say if you are following the hand wash practice as advocated, and you are taking the requisite amount of time in hand washing, or you are using the alcohol-based hand rub to clean your hands, we can be reasonably sure that our hands are clean. At some level, let's say efforts are being made by the organizations to make sure that their people are following the compliance. So now some of those methods which people have used is sometimes they mix what they call as a black light technology. They mix some UV light kind of it, they put some granules along with your detergent and the solutions, and once they have done it, and then they throw your hand into the UV light, it will shine up the areas which you have not cleaned. So that's one way that the hospitals find this thing. Another method is they call it ATP monitoring, that is the adenosine triphosphate monitoring. Similarly, try and do that where the people have not washed. Now the AI-based interesting thing has come out is that now you can say a kind of a cameras or a video capturing thing through even your mobile phone, and one of those modality we are actually launching today along with this organization called Data Culp, and that will help individuals and the organization to just the app analyzes that have you taken the proper steps, have you analyzed it, what has been your degree of compliance to the whole hand washing practice. So I feel that this pandemic has definitely brought about the need in everybody's mind. I think it has just to be taken to another level so that we follow those practices. And I hope at some time in life, you may get some gadget which is showing you organisms just like you are seeing flies or mosquitoes on your hand. Unfortunately, that's not so.
Got it. Dr. Lallu Joseph, surgeons in hospitals ensure hand hygiene and the safety before every surgery that they do. Also, physicians are ensuring hand hygiene to keep themselves safe as well. We've understood the safety is not just for the patient, but for your own self as well. But hospital has many non-medical staff, and I'm specifically asking this question because you're managing a hospital which is, more than 4,000 beds, and you have housekeeping staff, you have electricians, you have admin staff, security staff. All these people are touching and being a part of the ecosystem there. How does a hospital like yours ensure the message of safety passes on to them so that they can practice hand hygiene for the sake of the patients, for their own sake, and for the sake of their own family as well?
Yeah, thank you for that. Accreditation, by and large, has done wonders, I must say. This whole concept of training healthcare workers en masse did not exist at all before accreditation. Now, with every accreditation assessment, you are kind of told where, asked for your training records. Have you trained people on this? Have you trained people on that? By and large, my hospital has been accredited ever since 2013. This is the 10th year for us. So we have already faced about 6-7 assessments. Things have drastically changed. So what now happens is on induction, whether he's a doctor, a nurse, an administrator, a housekeeping professional, or a patient porter, everybody is trained on hand hygiene practices. When to use, how to use, and what are the steps for hand hygiene. And posters are displayed everywhere. And this is not just on induction. On a regular basis, on a mandatory basis, people have to undergo training and make sure that they clear the mandatory training programs. And another aspect is whenever the infection trends go up in a particular ICU or a ward, then everybody gets retrained. And there are people in the hospital called as the hospital infection control professionals who are on the ground like policemen, who are actually auditing to see if people are performing the right steps, if they're actually doing the right thing before they are entering the wards, the ICUs, anywhere. So it is not actually saying that it's only for the doctors or nurses. It is for everybody. It is universal. Because the electricians, as you rightly said, they go into the patient room when the light is not on or there's a problem with the geyser. So they touch everywhere. And they sometimes touch the patient bedside. They touch everywhere. So it is important that we train everybody universally. But the culture of this training and retraining has certainly come into the healthcare organizations, particularly because of this accreditation. And COVID, as we said, has done wonders again. They are scared of themselves, so of their own health. So after they come out of the ward and all that, they wash their hands. But the complaints is not to the level that we would want. That is why it is constant reiteration and that culture that we are talking about. It has to get into their head that it has to be done and not to be taken lightly. And particularly we tell them when their relatives are admitted, we tell them, you be cautious, you know what happens. So then it becomes part of them when their relatives are not admitted and others are admitted. So there are various examples that are told to them, explained to them, pictures shown to them of acquired infections in hospitals. So that way we are able to inculcate this culture slowly into our non-medical professionals as well.
And Dr. Agarwal, you have been a practicing doctor in the past, and then you moved on to administering and leading hospital chains. What do you think needs to happen beyond social media and print media campaigns to ensure hand hygiene? Do we have any best practices that we have seen that has worked across the world that we can learn from and kind of work on in India? Some studies that may have been done by WHO, etc. Anything that you would want to share?
See, one is, I would say, of course, the amount of sensitization right from the school level. Right, like I would say that, for example, smoking was a huge problem in the United States that has been completely and to a large extent been tackled by educating the school children, who were also then talking to their parents. Here for hand hygiene, I would say additionally, we must rope in role models. Just like the Prime Minister talked about the toilets, I think we need now more leaders. We need the likes of Dr. Trehan, Dr. Devi Shetty, Dr. Sudarshan Balal, Dr. ABC. All these people need to be shown that and come out with a message of hand hygiene, that I have washed my hands before and after my procedure. Do you do that? Or etc. I think we require role models, because sometimes people feel at a lower level as if they are being given this gyan while these people at the higher level or the senior level are not doing the same thing. So it needs to come from them that it is as important for the medical fraternity, like I think what toilets was for the whole country.
I completely agree with you, sir. Dr. Joseph, would you want to comment on this?
Yeah, certainly, I agree. And as I always say, it is the role models who will have to come to the front and project for healthcare workers. But for the others, I think it is empowerment of the local mass, the public, the schools, everywhere, asking them to ask the right questions to the healthcare workers. So, have you washed your hands? Not just for them, but for the person who's caring for them at home, whether it is a maid or their own parents. And also when they are admitted in a hospital, when they go for a procedure, they go elsewhere, even to a hotel, asking that question, have you washed your hands? I think that's something that's going to certainly help. It should become a mantra, which is why today we are launching this program on India Washes Hands. That's going to be the mantra for us for the next 1 year. With this AI tool, we are going to educate. We are trying to educate. I don't know how much we will be a success, but knowing the passion of all the healthcare workers towards this, we surely think that this is going to reach the mass. So we really need to educate everybody to ask that question. Have you washed your hands before touching that person, whoever it is? If they start asking, if India starts asking, then it will happen.
Is this your message on the Hand Hygiene Day, or would you want to share a message? And when you share a message on the Hand Hygiene Day, it has to be for two sets of people. One is, what is your message to the healthcare workers, and what is your message to the general public, the community?
Yeah, to the community, certainly ask the right question. That is what I would say. Ask everyone, have you washed your hands? But for the healthcare worker, I think clean hands, as WHO has rightly said, it is a sign of respect to those who seek care. So you respect that person, you wash your hands. So certainly clean care is a sign of respect. Clean hand is a sign of respect for those whom you care. That's probably the message.
Great, ma'am. Dr. Agarwal, what would be your message on the Hand Hygiene Day for the doctors, as for the healthcare workers, as well as for the general public?
I will say my message to the healthcare workers, especially to my colleagues, my clinicians, my doctors, you have to lead by example. You have to lead by example, and that's where you can bring about this change. Our country, we were very naturally inclined towards hand washing. And in fact, another aspect of, I would say, greeting namaste is extremely important rather than handshake. That again, I think is an issue that we have to lead all these things by example. And I think it is the right time for us just to push the envelope a little more. The benefit that pandemic has given us, let's not kind of forget it. I feel that some clear messages coming repeatedly, also through the media platform like yours or from the leading institutions, will do a great job in sensitizing everybody. And also to show, maybe, I will say that let us also start appreciating and recognizing people who have are leading, for example, the institutions who can show that they have done this exceedingly good work. They should be recognized, they should be showcased so that it becomes an encouragement for others.
Got it. I think, this is brilliant because when you were talking of, Dr. Joseph, when you were talking about that it needs to happen in schools, and Dr. Agarwal also mentioned this. I think, children learn from their teachers, children learn from observing things at home. So if every parent sitting on a dining table asks their child that, I have washed my hands, have you, is something which could be the mantra, which could be a part of their lifestyle every day, rather than trying to teach someone that, you must do this. And, some of the takeaways from this conversation today have been that rather than working in silos of excellence, as Dr. Joseph said, it is important to look at how various industries have integrated. And it is time that all of us in the healthcare industry come together for certain common causes so that we can build the culture of hygiene, not just hand hygiene. And second is, every healthcare worker has to focus on creating a moral responsibility among themselves. And as you mentioned that it's a mark of respect to someone who has come to seek care from you. They've come to be well and not to become unwell. So that's a moral responsibility of every healthcare worker. And third is, we are blessed that technology has advanced today, where we have, an opportunity to not just check ourselves, but make it as a SOP that, a doctor or a surgeon who's going in for a surgery needs to check his hand using an app to find out if he's actually safe to conduct this surgery. So I think, we've come a long way, like I was saying, from stained walls to a spick and span hospital reception lobby. It is a journey that has happened. We have seen that it works, and learn from it and let the journey be on so that we can build even safer places today. I really thank you for taking out time, Dr. Agarwal, Dr. Joseph, to be with us today on this special Hand Hygiene Day to share your thoughts and encouraging everyone else to do the same.
Thank you, Harbinder. Thank you.
Thank you. Thank you so much.